Hi, I'm Dr. Lucietto, and I'm so glad you're back to join me for a few minutes. I've had some people ask me about alcohol use, and I think that's an important thing to discuss. I think that's an important thing to be aware of what is considered too much and when a person should stop. Now, technically, there is no medical benefit really to using alcohol. Now, in the past, it's been used for treatment of wounds, such as cleaning them, but we have better agents to clean wounds. We've also used it to help calm people down. But there are better agents and better methods used to calm a person down. Ethanol or alcohol has also been used in preterm labor. And believe me, there are far better agents available to treat preterm labor. Alcohol should never be consumed by anyone who is pregnant because of the risk of fetal alcohol syndrome. We're still at a point where we don't know if it's timing, amount, or if it has something to do with genetics, but alcohol and babies don't mix well. So, no alcohol if you're pregnant. When it comes to consuming alcohol pretty much is metabolized by the liver. And it is broken down into sugar and water, ultimately. There are different stages to it. If you're concerned about how much is too much, you have to ask yourself, well, in a week, how much alcohol do I consume? Or how much alcohol does my dad consume? Or how much alcohol does my mom consume? Now, if a male consumes more than 14 drinks a week or a female more than 7 drinks a week, this is an indicator for a potential problem. If at any one time or one sitting an individual drinks more than 4 drinks for men and 3 drinks for women, that is also another red flag. That could be a sign of a problem with alcohol. A standard drink is considered any beverage that contains 14 grams of alcohol. 14 grams of alcohol is usually found in about 5 ounces of wine or 12 ounces of beer or 1.5 ounces of hard liquor, which would be something around 80 proof or 40% alcohol. That's what's considered a standard drink. But that doesn't mean that's what a person drinks in one drink. Many times people have larger wine glasses. They have mixtures of hard liquor that have multiple shots in it. And so when you think about it, one beverage may actually be that limit of consumption for a sitting. Now, that's not to say that if a person drinks more than 14 drinks for a male and 7 drinks for a female a week, that, oh my God, they're an alcoholic. No. You also have to look at the whole picture. Does it impair that person's judgment so that they put themselves at risk? Does it impair that person's judgment so that it puts their loved ones at risk? Does it cause that person to have inhibitions that puts them into an unsafe situation? To try to avoid problems such as that, it's a good idea not to drink alone. Drinking alone can be a problem because it's very easy, just like eating a bag of potato chips, to drink more than you should when you are by yourself. So you want to adopt the idea of safe drinking. Safe drinking means no driving. Safe drinking means no alcohol with water sports. Safe drinking means no operation of heavy equipment. Safe drinking means no drinking and babysitting. You need to have your faculties together in order to drink responsibly. And the drinking is not so important. I have to admit, I have had patients in the past that have told me, oh, when I drink, I do not take my prescription medication. Well, I guess in one way that's good because you shouldn't combine prescription medication and alcohol because it changes how your body handles the medication, and the alcohol can sometimes have a potentiated or worse effect on you. Now, research has shown that sometimes there has been a benefit noted with alcohol use, and then there is research that has shown there is no benefit. Alcohol is associated with an increased risk of cancer, as well as an increased risk of dementia, as well as an increased risk of liver damage, kidney failure, heart disease, lots of problems. But that doesn't stop people from drinking. And it will not stop a person from being able to safely use alcohol. Now, anyone who's been diagnosed or has been known to have substance use disorder or alcohol use disorder, they should never drink, not even one drink. It's the old story that 10 drinks are not enough and one is too much. That is a problem for a person who already has an underlying condition or disease that puts them at risk for using too much alcohol. So I hope this bit of information is useful for you. And if you need help, you can access help. There are many different drug treatment centers that you can look up on the internet to see about accessing assistance. You can also talk about it with your doctor. There is a great amount of information available and treatments available to help a person who is using too much alcohol. Your safe drinking is probably best if it's without alcohol, but if you have a problem, there are things that we can do to help. And that's important for you to understand. And don't beat yourself up. Get help. Punishing yourself isn't going to help. Well, thank you. And hopefully we'll talk about some other substances in the future. And as always, you guys have a great day. And remember, your health is way too important to be taken seriously.